Imagine a patient who is dizzy, pale, and has a heart rate dropping below 40 beats per minute. This is symptomatic bradycardia, a clinical emergency where the heart cannot pump enough oxygenated blood. As a nurse, you need to recognize these signs of low cardiac output immediately to prevent further deterioration. Atropine is your primary pharmacological tool for stabilizing this patient quickly.
Atropine works as a competitive muscarinic antagonist, blocking acetylcholine from binding to its receptors in the heart. Specifically, it inhibits the vagus nerve, which normally acts as a brake to keep the heart rate slow. By removing this parasympathetic brake, the sinoatrial node is allowed to fire much more rapidly. This mechanism directly increases the heart rate and improves electrical conduction through the AV node.
Administer atropine 0.5 milligrams via rapid IV push, repeating every 3 to 5 minutes up to a maximum dose. After administration, monitor the patient for common anticholinergic side effects like dry mouth, blurred vision, and urinary retention. Always maintain continuous cardiac monitoring to assess the rhythm's response, and be prepared for transcutaneous pacing if the drug fails. Remember that atropine may not be effective for high-degree heart blocks.